everybody. This is Dr. Britt Daly Daniel, MD, a neurologist and headache doctor, and today I'm doing a podcast on the subject of, does Emgality help cluster headaches? Well, cluster classification. Cluster headaches are the most severe headaches known to man. They are called suicide headaches for good reason. It's interesting that when the first American classification of headaches was released in the JAMA in 1962, it had migraine as the main classification of headache, and underneath the name migraine were listed different types of migraine, such as common migraine, classical migraine, hemiplegic migraine, and at the bottom, cluster headache. That is, cluster headache was originally listed as a type of migraine, but that was long ago. And now the International Classification of Headache Disorder, first published in 1988, and now called ICHD-3, has cluster headache as separate from migraine, and it's called a trigeminal autonomic cephalgia. All right, so does Emgality work for cluster headaches? Emgality is the first ever treatment for episodic cluster headache in adults that reduces the frequency of attacks, period. Emgality is a monoclonal antibody that blocks calcitonin gene-related peptide, CGRP, and CGRP has been shown to be involved in the development of cluster headache. Related questions. What's the data showing that Emgality worked? The first FDA approval came after a clinical trial comparing Emgality to placebo, which showed that patients who were taking Emgality experienced 8.7 fewer cluster headache attacks than patients taking placebo after 3 weeks. And the most commonly reported adverse reaction during the trial was an injection site reaction. It's like a little bruise. Open quote, Emgality provides patients with the first FDA-approved drug that reduces frequency of attacks of episodic cluster headache, which are an extremely painful and often debilitating condition, said Eric Bastings, MD, Deputy Control of the Division of Neurology Products in the FDA's Center for Drug Evaluation and Research. Are there similarities and differences between migraine and cluster headache? There are similarities and differences, except for rare findings of one-sided eyelid drooping and one-sided pupillary smallness, which is called miosis, found usually only with older patients who've had cluster headache for years and called Horner syndrome. Both migraine and cluster headache have a normal neurologic exam. What does the MRI scan show? Both migraine and cluster headache have normal cerebral MRI scans, except that 30-40% of migraine patients may have microvascular T2 lesions, or what's called in the trade migraine freckles. That's what I like to call them, to reassure the patient that this is benign and currently thought to mean nothing serious. What is the clinical occurrence of cluster headache? Episodic migraine usually only comes several times a week and has symptoms of headache occurring one side of the head in 80% of patients. However, migraine may switch sides, like from right to left, although many patients will say that it usually just comes on one side. Cluster headaches come without warning and reach peak within 2 to 15 minutes, which is different from a typical migraine without a heart attack, which usually takes half an hour to several hours between onset and peak of a migraine headache pain. Cluster headaches are very severe, quick onset, one-sided headaches, which consist of pain around the eye, the temple, or cheek. Cluster headaches may track the clock, coming at the same time every day. This periodicity is a key feature of cluster headache. The attacks of pain recur at the same time each day for the duration of the cluster bout. The attacks characteristically occur 1 to 2 hours after going to sleep in half of patients. So if the patient goes to bed at 10, they may have a cluster headache at midnight, which wakes them up. An attack of this time corresponds with dreaming and REM stage sleep. Some patients have several attacks at night, consistently interrupting sleep. Some patients get daytime attacks associated with napping or relaxation. 75% of attacks occur between 9 p.m. and 10 a.m. With cluster, the duration of the attacks ranges from 15 to 180 minutes, with most cases lasting about 30 minutes to 2 hours, with a mean of about 45 minutes. The attacks may occur 1 to 8 times a day, and the patient is pain-free between the attacks. That's an important differential later we'll discuss with medication-overuse headache, where the patient really has headache all the time with periods of spikes of headache on top of that. What are the attacks like, the cluster period? The headaches come in time periods called cluster, which usually last 6 to 12 weeks. The term cluster here means that the headaches cluster together in time, much like grapes cluster together on the vine. Thus, the patient may state that he had 6 weeks of headaches in March and April of 2017, but then the headaches completely stopped. Following this, there were no headaches in all of 2018, but they started again in March of 2019 and brought the patient to the doctor. Although the usual cluster period is 1.5 to 3 months, average cluster time is 6 weeks. 10% of patients develop chronic cluster-type headaches all year round, and in these patients, the cluster term is really meaningless. Also, cluster headaches may cycle between intermittent or the typical cluster pattern and chronic daily cluster headaches. Chronic cluster patients may evolve into an episodic form also without treatment. Although some cluster periods occur in the spring and fall, other researchers have found cluster cycles in February and June that seem to occur at the time of an increase in daylight hours. Cluster attacks occur 7 to 10 days before the longest and shortest day in the year, suggesting that the pineal gland located in the center of the brain may be involved. What is the headache location? Cluster headaches are strictly one-sided temporal or supratemporal located pain. Only 15% of patients will switch sides for the duration of a bout. Very rarely, the pain will switch sides during the cluster period. Migraine may occur on one side, in the temple, forehead, behind the eye, in the back of the head on one side, or in the cheek located trigeminal sinus area on one or both sides of the face. Migraine starting in the back of the head on one side may move to behind the eye on the same side later during the headache period. What are the episodes like for cluster headache? Episodic migraine may come once or twice a week and defined as lasting 4 to 72 hours. Chronic medication, usually caused by medication overuse, is defined as having 15 headache days a month, 8 of which have migraine features. Episodic cluster headache comes in clusters, usually in the spring or in the fall, lasting about 6 weeks. During the 6 weeks cluster time, headaches may come up to 8 times a day and last 15 to 180 minutes. And 10% of cluster headache patients may have chronic cluster headache, which is continuous attacks with no remission. What's the response to triptan therapy for acute onset? Both migraine and cluster headache respond to acute triptan therapy. Cluster headaches come on so quickly and produce onset to peak pain in 2 to 5 minutes. And the pain onset for migraine is usually longer, about 30 to 60 minutes. Because of their quick onset, only large dose, fast onset triptan therapy will work. Suggested drugs are 6 milligrams subcutaneous sumatriptan, 25 milligram nasal spray sumatriptan, or 5 milligram nasal spray zolmitriptan. 6 milligram sub-Q sumatriptan, though, is generally considered the best treatment. Nasal spray triptan and zolmitriptan treatment onset is as fast as sumatriptan subcutaneously injectable as 10 minutes for those drugs. However, nasal spray sumatriptan gives a low-level medication in the brain of 10 milligrams, while 6 milligrams subcutaneous sumatriptan gets a level of 100 milligrams. So, injectable 6 milligrams sumatriptan is the most effective acute treatment for migraine and cluster headache. Usually oral treatments don't work. What's the insurance coverage for triptan use for cluster headache? There is poor insurance cover for subcutaneous sumatriptan, which is the best drug. Glaxo, the pharmaceutical company that brought out sumatriptan, only got an FDA indication for treating migraine, but never for cluster headache, and it's been 29 years and no indications yet has come, and I don't think it's coming. Therefore, since medical insurance companies only approve and pay for drugs that have an FDA indication for use, United States medical insurance companies don't adequately cover cluster headache. They'll usually allow 9 or 6 milligram subcutaneous shots of sumatriptan like they would cover for migraine, but that's it. It's not enough to cover a neurological condition that may occur 8 times a day every day for 6 weeks. So that's a real problem. The doctor can ask for an insurance override, but those are hard to get. There are articles warning that medication-overuse headache may occur with cluster headache, but it must be rare unless the patient is mistakenly taking opioids or butalbital for treatment. What's the response of cluster headache to oxygen treatment? Cluster headache usually responds quickly to nasal oxygen delivered via a scuba tank oxygen cylinder, tubing, and nasal prongs or a mask. This is great since oxygen is oxygen. It's not toxic or expensive. It would usually stop a cluster headache attack in minutes. Also, there's some older data on success with nasal oxygen for migraine, although it usually requires longer duration of therapy, like an hour. What are the indications for Emgality? Emgality is a prescription medicine used in adults for the prevention of migraine, and it's also indicated for episodic cluster headache. And the medicine is 300 milligrams. It comes in 300 milligram pre-filled syringes, which are taken one after the other at the start of a cluster period and then every month until the end of the cluster period. What are the warnings and side effects of Emgality? Do not use Emgality if you're allergic to it or any other ingredients in Emgality. Emgality may cause allergic reactions such as itching, rash, hives, and trouble breathing. Allergic reactions can happen days after using Emgality. Call your healthcare provider or get emergency medical help right there if you have any of the following symptoms, which may be part of an allergic reaction: swelling of your face, mouth, tongue, or throat, or trouble breathing. What about the use of Emgality with other drugs? Emgality is one of the 3 FDA-approved drugs for treating migraine, and the only other group indicated for treating cluster headache. Emgality blocks the effect of CGRP, one of the neurotoxins released in the brain with migraine and cluster headache. These CGRP antibody drugs have no effect with any other known drug. It can be used liberally and safely with any other drug. There's never seen anything like it. These drugs have no contraindication with other drugs. For instance, penicillin has 10 or more drugs that cannot be used when the patient's on penicillin, but the CGRP drugs can be used with any drug. What are the common side effects of Emgality? Well, the most common side effect of Emgality is the injection site reaction, which is like a bruise when you have blood drawn. This is from the subcutaneous injection with a small needle, and is like a bruise you get from blood for lab tests drawn in the arm. Now remember, diabetics give subcutaneous shots 4 times a day for life. What are migraine without R symptoms? To have an accurate diagnosis of migraine, there should be 5 similar attacks with symptoms as follow below. The migraine attacks last 4 to 72 hours. The attack should have 2 of the following 4 symptoms: one-sided pain, throbbing or pulsatile pain. Pain is moderate or severe on a 1 to 10 scale. Migraine is over 5 and up to 10. Migraine pain is disabling, so the patient wants to be still or lie down and sleep. Thus, an attack of migraine may limit social activity or work. And the attack should have 2 of the following 4 symptoms: nausea, vomiting, sensitivity to light, called photophobia, or sensitivity to sound, called sonophobia. What are cluster symptoms? Well, at least 5 attacks fulfilling B to D below. B is severe, one-sided, orbital, supraorbital, and or temporal pain lasting 15 to 180 minutes. C, the attack is associated with at least one of the following signs on the side of the pain: conjunctival injection, which means redness of the eye; lacrimation, which means tearing; nasal congestion, just like a runny nose; rhinorrhea. Nasal congestion is stopped up nose; rhinorrhea is a runny nose; forehead and facial sweating; myosis, which means small pupil on the side of the headache; ptosis means upper lid mild drooping during the headache; eyelid edema. The frequency should be for 1 every day to 8 a day. And you got to have at least one of the following. The history of physical neurologic exams do not suggest disorders in any other group of headache types. and the test should rule any severe problem out. What do cluster clinical features mean? During the cluster headache, in addition to pain, the patient may experience symptoms on one side of the face, around the eye, upper cheeks, or temple. What's the pain description for cluster headache? The pain begins quickly without warning. It's excruciating in intensity and explosive in quality. Rarely the pain is pulsatile. Patients describe the headaches as killer headache or suicide headache. The pain may be boring, stabbing, burning, like a knife, like a hot poker in the eye, and sometimes pulsatile, throbbing, squeezing, or aching. At the end of the attack, the symptoms resolve in 1 to 2 minutes. What's the warning for pregnancy and breastfeeding using Emgality? None of the CGRP drugs are indicated during pregnancy and breastfeeding, and none of them are approved for children or persons under 18 years of age. What you do for missed dose of the drug. If a dose is missed, then the drug should be given as soon as possible if the patient aware of it and is able to do it. Then that date of the injection is used as the new marker to count 1 month to the next dose. Put dosing medication in your cell phone with an alarm marking the date and time. Also, tell your family, friends, or sometimes your coworker about your dosing schedule so they may help you not to forget. What about the confusion between cluster headache and chronic migraine due to medication overuse headache? Patients and doctors get these two headache entities mixed up all the time, and I hear it in the office. The patient will have a headache that lasts, it's like migraine, but doesn't have cluster features. Cluster headaches usually occurs in men that are type A, hard-driven types. I once saw a patient with cluster headache who had 4 beepers. Remember beepers for work back in the 70s? He had a beeper for his business, one for being the chief of police department in the small Texas town where he worked, another one for being chief of the fire department, and another for his mother who was sick and bedfast. But these social psychiatric features don't separate cluster from migraine. Cluster headache comes the same time every day, multiple attacks every day, and they lock into time like 2 in the morning or 9 every day in the morning. And cluster headaches are quick onset to peak, extremely severe headaches that last an average time of 45 minutes, while migraine's onset to peak is longer, and episodes of migraine can last 4 to 72 hours. Chronic migraine due to medication overuse headache is usually a wake-up headache that gets better after the patient takes his butalbital or some other drug that aggravates medication overuse headache, only return hours later as another severe headache. That's kind of rebound headache idea. So medication overuse headache used to be called rebound headache. You would rebound from the drug use. The headache with medication overuse headache doesn't really go away. It may persist as pain in the neck or back of the head, whereas between attacks, cluster headache really goes away. That's headache-free. The big features of cluster headache are autonomic features, as forehead sweating, one-sided lid drooping, a small pupil observed by the very observant patient or spouse, redness of the conjunctiva, lacrimation, usually just on one side, the cluster side, and nasal congestion. Migraine may rarely have some of these features, but migraine has strong throbbing, nausea, and vomiting, and sensitivity to light and sound. The activity of the patient will also give it away. Cluster patients get up and pace around the room. They're hyper, in extreme pain. They beat their head against the wall. Sometimes they'll push something sharp, like a paper clip in the flesh of their head where it hurts so bad. But migraine patients go down. They go to bed. They try to go to sleep, because sleep may reset the brain and treat the migraine. So this is the end of my talks on does Emgality help cluster headache. Please click subscribe down there so we can follow each other. Please listen to other podcasts I have on migraine and other medical problems. God bless any of you folks that have migraine, medication overuse headache, or even cluster headache. And I will see you again on another talk.